Good evening and welcome into another edition of One-on-One with Hubert Smith. And tonight we are continuing with our three-part series on the Patient Protection and Affordable Care Act. And with me tonight, as she was last week, is Dr. Mary Hedrick. She is a retired physician from Union County and is board certified in internal medicine. She has worked in medical physician clinics and emergency rooms for over 30 years. During her years in practice, she worked for healthcare reform and the principles of universal affordable healthcare, So I'd like to welcome you back, Dr. Hedrick.
Thank you for having me again.
Thank you so much. And so let me tell you, our viewers and listeners, just to remind you that we are broadcasting on Comcast Channel 12, Knowledge and Charter Channel 6, AT&T UVerse Channel 99, and we are streaming on www, don't know why I say that, but I do, ctvknox.org. So if you know of someone, and I can't think of who wouldn't be interested in this particular topic, because it affects all of us, perhaps directly or indirectly, because it is the law now, give them a call and let them know that they can go online if they are outside of Knox County and don't have cable, or in Knox County and don't have cable, still like to watch online, ctvknox.org. Now, just to remind you again that last week we began part one of a three-part series on the Affordable Care Act. And Dr. Hedrick is a foremost expert on this particular topic. She has spent years, continues to spend time. She just came back from Nashville again last week from about 5 days there, learning more about this information. And she has agreed to be with us for 3 successive Fridays and talk about this particular topic. Now, we will be coming back to you again on next Friday on the 25th, where we will take phone calls. And the reason that we're not taking phone calls on these first 2 shows, because there's so much information out there that I wanted to allow Dr. Hedrick an opportunity to get out the information before we start with your questions, because we know that your questions will come from near and far and wide. And so we want to have some foundation to build upon, so when we take your questions asking about some things that we may have covered or some things that we may not have covered, we've gotten at least the primary information out there to where you may make an informed decision. Now, let me do my disclaimer. Dr. Hedrick is an advocate of this. I am not, nor is community television. We're doing this as a informational series only on my part. But Dr. Hedrick is an advocate, and she speaks very passionately about it. So take from it what you will, hopefully a lot. Hopefully you will learn a lot more than you did before we started this 2 weeks ago, and that this will be a beneficial broadcast for you to make decisions as individuals. So having said that, let me reintroduce again Dr. Mary Hedrick. And Dr. Hedrick, take it away.
All right. I told you I was going to, first of all, I have not grown since last week. I'm on a booster seat, so because you're so much taller than I am. However, to review part of last week, I thought I'd ask you a few questions and see what you thought the takeaway message was. So first of all,
I had homework?
Yeah, you did. What was the full name of the act?
The Patient Protection and Affordable Healthcare Act.
Very good, very good. Got that one. Yep.
I didn't know this was. This is a pop quiz.
And when we talked last week, we talked about some of the things that were going to be new for everyone, whether or not you bought this new insurance. And do you remember any of those things?
Ask me that again, please.
The things that were going to be new for everyone, they have to do with that protection part of the healthcare law name. The protection part. And I'll jar your memory.
Deer in the headlights look. So.
I'll jar your memory. I told you about a patient I had who had job-based health insurance and had gotten pre-approved for heart surgery. And while he was recovering, his insurance representative came and said they had changed their mind and decided that his was a pre-existing condition and they would not pay for it.
I do recall part of that story.
Yeah.
But I don't remember the answer to the question.
Well, the 2 important words in the Act's name are patient protection and affordability. And there are lots of protections that may not be obvious to everyone, since we hope they won't get ill in years to come. But if they do, there are many protections there, like not being able to get insurance in the past because they had a condition of some sort medically. Now they can. They can't be excluded. They can't be charged extra because they have cancer or a family history of some disease. And additionally, they can't be kicked off for frivolous reasons just because they've gotten an illness with some claims that they have submitted. So those were some of the important protections for everyone in the Act. The health insurance reform part. And then the other aspect of that was the rules for insurance companies and how they charge for health insurance. And I told you there was a insurance term called modified community rating, which meant that what things alter your premium for health insurance? What things are they allowed to look at and change your, not your illness?
I'm kind of being like Barney on Andy Griffith now, you
Okay.
know, when he's reciting the preamble to the Constitution.
Well, who do you think would cost more for health insurance, a 20-year-old or a 64-year-old?
64.
Sure, you got it. So age will affect how much your premiums are. And then, of course, where you live. Folks in California will have a different rate from those of us here in East Tennessee. And then there was one more thing that we didn't talk about that I should have mentioned, and I told you there was a tobacco penalty. Do you
If you
remember?
smoke.
Yeah. So really those three things are what should modify your premium, what you're charged: your age, where you live, and then if you have tobacco use, whether it's cigarettes or chewing tobacco or snuff or dip, those can alter your insurance, and you won't get help paying for your tobacco penalty. So it's going to be important that folks really work hard on getting rid of tobacco use. So that's a big part of affordability. So those were the protection parts, and then we talked about how important it was to know poverty level. Do you remember the little trick I gave you on how to calculate that?
It was some percentage of the poverty rate.
Right. Folks whose income is low income, meaning 100% to 400% of poverty, they're not poor, they're not impoverished. Most of them are working very hard, but they might have difficulty paying for health insurance, particularly as they got older and the premiums were higher. So it is important for folks to understand income related to poverty level. And I gave you two numbers that I'll repeat for folks who just want to do the arithmetic for a family member or their own household. $11,490 a year, 11490 per year, is the poverty level, the poverty line for a household of one person. And then for each additional person in that household, you add $4,020. So for a family of four, mom, dad, and two children, you add $4,020 three times, and you get the poverty line for a family of four is $23,550. So that's the poverty line where folks may be able to start getting help paying for their premium. But for that family with $23,550 a year income, if you multiply that by 4 to get 400% of income, you get close to $99,000. At that point, even if it was older family members, they would stop at 400% getting any sort of opportunity to apply for help paying for things. So that is helpful, but we're going to show today a link on the internet where if you don't like to do that arithmetic and your calculator doesn't have any live batteries any longer, you can go and just feed in your income and family size, and that will spit back out for you. And that is a link that is working for everyone. It doesn't have the bottleneck we've heard about for the healthcare.gov, where so many millions are trying to access and sign up for insurance and running into obstacles right now.
Sorry, folks, I had to mute my phone. I just thought, oh my goodness, it would be a bad time for my phone to go off right in the middle of a quiz.
Might be the president calling with a question.
Well, maybe. He took a little shot at the president there.
No.
No. A lot of viewers might like that.
Well, every state's different, and so there are some questions that you want to know the Tennessee answer. Like TennCare is our Medicaid program. And so we talked about the poverty level, and we talked about the 3 levels of coverage that people can be sent to if they apply for this new opportunity. Do you remember the 3 places that they might be sent?
No. But I'm taking notes
Look
this
in the
time.
orange and the yellow behind me, the marketplace. That's number 1.
Okay.
So they might be sent to the marketplace to shop for health insurance after they applied. They might be sent to that red area behind us, and that is traditional TennCare. And then in the furthest on your shoulder over there, that is the area where children could be sent for the CHIP program, Children's Health Insurance Program, the federal program for the youngsters. So the way Tennessee is set up, if you're going to be able to travel through this application process successfully, you'll be sent to one of 3 places: the marketplace, or to traditional TennCare, or to the CHIP Children's Plan. However, do you remember that the folks that I'm pretty worried about that I don't think are going to be able to get insurance still?
The ones over a certain age?
No, the ones under 100% of poverty, the ones who aren't at the poverty line but they're below it. And do you remember what the issue was, that for Tennessee we only have 3 places to send people instead of 4? Some states have made a choice and they have 4 opportunities to send folks. Do you remember why some of our under 100% poverty are left out?
I'm already failing. Please tell me.
Okay, those are the folks who are childless adults under the poverty line. And we had the opportunity to accept what's called TennCare expansion, and that's different from traditional TennCare. And our governor did not choose to accept those federal funds. Had he accepted those, then those childless adults who cannot get traditional TennCare could have gotten TennCare expansion coverage, and for 3 years the federal government was going to pay the complete 100% tab for that population. And those folks are just still, in my opinion, cruelly omitted from this health reform
Is it too
opportunity.
late?
It is my understanding, really from our local newspaper, that every quarter the governor and legislator could say, okay, we'll do that for a while, and we could cancel it at any point if we had a problem with it. So it is probably too late for January 1, but they might be able to pull some strings. I just wish there was the political will to do that, because I have gotten so many phone calls. For example, may I give you an example?
Sure.
All right, there was a woman who called. She's in her 50s. She has to stay home. She can't work because her husband is disabled. So they live on his SSDI disability Social Security check, which gives them about $5,600 per year to live on.
It's not much.
That is their full income on his disability payments. And she has to stay home because he can't stay home alone. And she had breast cancer 10 years ago, successfully treated. And because of that, she needs follow-up and mammograms regularly, because she's at risk more than most women for getting another breast cancer. Additionally, her brother just died of colon cancer, which places her at increased risk for colon polyps, but she's never had a barium enema or colonoscopy because she doesn't have health insurance. And at $5,600 a year, that couple obviously cannot afford $1,000 or $600 or $400 in premiums each month. And they won't get any subsidies or help because we have not accepted that TennCare expansion for our, and remember, we paid over $46 billion of Tennessee tax dollars to Washington, D.C., and Washington, D.C. said, we will give you over this next 3 years about $3 billion back to pay for this poor population, and we declined that.
If you're just tuning in, my guest tonight is Dr. Mary Hedrick. She has worked in the emergency rooms and clinics for over 30 years. She is board certified in internal medicine. And Dr. Hedrick, let me ask you, why have you taken such an interest in this topic?
It's pretty heartbreaking when you see a patient that you would like to help, and even if the physician gave free care to a patient, they couldn't get the tests, the x-rays, the referral to the specialist that might save lives and decrease suffering. So throughout the 30 years, I've seen so many people, and it just broke my heart to have to give them less than the care they really, I thought, deserved. So, and I don't, like some folks believe that health care is a right, and I don't have that view that health care is a right like free speech, but I do think it's a social good, and I would like us to provide it.
So what we're doing, we did this last Friday. We're doing it again tonight on the 18th, and we will be doing it again on the 25th. But the 25th, we will be taking your phone calls, but there was such a large amount of information, we wanted to establish some baseline, so when you do call in with your questions on next Friday, you will at least hopefully do better than I have done today and had some knowledge and foundation. So you see, I'm writing all this stuff down. I'm getting embarrassed on my own show. Didn't know there's going to be a quiz, but I'll be ready next week, I guarantee you that. So Dr. Hedrick, for the time we have remaining, we might want to get into more of getting some information out there.
Yes,
okay.
yes. And as you know, these first few weeks in October, there's been a bottleneck applying online with a lot of frozen panes on the internet site and some holds on the telephone number, because for states like Tennessee that have the federal exchange, we rely on that network that supplies quite a few states for all that information, and apparently it was designed for 50,000 people to be able to sign up and enroll each day, and we're getting well over 200,000 each day these first weeks of October. So this being October 18th, I want to reassure folks that you still have 8 weeks to complete your application process and still begin coverage January 1 of 2014. So if you can get everything done by the middle of December, December 15th, then you're in good shape. And I'm going to just put this up, and I'll leave it in front of you and I for a while.
Okay.
This gives some important phone numbers for folks. The Kappa and Cherokee have telephone numbers if folks want to call and set up an appointment to apply. And the Kappa number, can you read that on your screen? I have to turn it back around if I'm
531-2766, I believe.
Yep, and that's 865. And then for Cherokee, there's an 800 number, and that's 1-866-672-1979. And that gives you 2 local phone numbers rather than the federal number that you can call to try to get additional information or an appointment. And then if we see that bottleneck open up with the internet, we also have the healthcare.gov site, www.healthcare.gov, G-O-V, and also their 800 number.
And that's 1-800-318-2596.
So we'll do these phone numbers again near the end, but these are ways that you can begin this process through several different vehicles, depending on how successful the folks are at healthcare.gov at opening up that website for everyone.
Now, can I ask you a question?
Yes.
Okay. This isn't a review from last week.
Okay.
This is a question that I've heard throughout the course of the week, just listening to talk radio and having conversations. And the question is, how will this affect current HIPAA laws?
With the current HIPAA laws, the insurance companies were allowed to exclude you for a pre-existing illness, and they were allowed to charge you more if you had diabetes or multiple sclerosis or Lou Gehrig's disease. So for all insurance policies, whether you're in a small business or whether you're an individual or a large business, you cannot be charged more because you have a disease condition or a high risk or have gotten ill.
Okay, so what about the privacy portion of that, about how information can be shared now?
The privacy changes are not really part of the Affordable Care Act. There are what we call electronic medical record rules that have come into being, and those electronic medical record rules are allowing the aggregation of large numbers of medical information studies without identifying individuals. So let's say that there were 20,000 individuals in East Tennessee with lung cancer. They could look at age, smoking status, but they wouldn't be able to list the names and addresses and phone numbers of those particular patients, but they can do the studies where an individual can't be identified. But let's say that someone had a very unique allergy reaction to a new medication and they were the only one in the entire state of Tennessee, you obviously couldn't report that and not risk identifying that patient. So the way they use our medical data has to be very protective of our privacy, and there are pretty harsh rules for a violation of those privacies. I'm required to shred the written records that I have, and you see those great big trucks doing that. So that's the same. And then the HIPAA law still has that COBRA requirement that if you leave your job or are laid off or terminated because of a reduction, the folks have to continue, if they're in a large group policy, to offer you that health insurance, although you'd have to pay it yourself for up to 18 months, and that includes folks who leave because of a disability. So COBRA rules still apply, but as many people find out, when they leave their job and pay for their COBRA insurance, it's prohibitively expensive because they're not getting help from the employer.
So I'm see if I'm reading you correctly. Then there's no reason to be concerned about because of the advent of the Affordable Care Act, that your records information will be any less private than they are now.
No, there should be no concern. My only caution to folks is that I've told you the healthcare.gov is the official site. People have bought healthcare.com and healthcare.org